Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty.
All right, Linda, tell me what's going on with your thumb. What happened?
Okay, so I'll tell you the same story I told you before. About 2 years ago,
Okay.
I was running back to my house.
Okay.
And the hill right in front of my house, the front yard, goes uphill, and I fell, and I jammed my thumb really bad into the hill, and so it's been hurting for like 2 years. I mean, really hurting.
How much
And-
pain at worst from 0 to 10?
Well, I started going to the acupuncturist about 2 months ago, and it was totally at a 10 at that point.
Okay.
But I'd say it's been at about a 6 to 8
Okay.
most of the 2 years.
Yes.
But I kept thinking, oh, it'll heal.
Okay. How long you've been seeing the
I've been
acupuncturist?
seeing the acupuncturist about 6 to 8 weeks now, once a week.
6 to 8 weeks.
Yeah,
Okay.
and so that's why at the moment it is much better.
But
and I've
you
been
still
wearing-
have...
Oh, I just spilled my water.
That's okay.
I've been wearing this little thumb guard.
Okay.
And she's been telling me to keep it rested.
Okay.
Don't use it. Blah blah blah.
You
blah.
right or left-handed?
Right-handed.
Okay.
But as soon as I try and ever do anything,
Okay.
it immediately starts to
So
ache.
you have not recovered yet. You're not able to use it now.
It aches and it triggers.
Yeah.
And the triggering.
You
is
feel like
very
it
painful.
stucks. You're.
What happens is when it triggers, I literally have to pull it back out. It won't. I mean, it's like
So you feel like it's stuck.
it literally it
It's
pulls back. It physically pulls back and locks in.
Oh, okay.
Yeah, I mean it's like a physical. It really moves.
So if we're gonna aggravate your symptoms now, what we can do to aggravate it, so I can use it before and after treatment to assess your response to the treatment.
I'm not positive what I specifically could do. I mean, if you have some ideas.
Yes, I have some tests I can do to aggravate it.
I'll
Okay.
let you make the
All right.
decision.
So we'll have you take this. So one of the tests is get your thumb like this. Your thumb all the way down like this. You're not able to do that.
I don't think so.
So look at the thumb. So normally we should be able to do this. This is normal. Can you do that? Touch your pinky. You see how slow? And you're not touching it. Can you touch this? Like this?
Yeah.
Oh, that's taking a while. Okay, is that painful? What's going on?
It's just
Tight?
tight.
Okay, so that's normal, you see, the normal? And it took her like 20 seconds to do that. Okay, so let's try to go to the this side, this. That's fine. So this is a problem. So one of the tests is we actually bring it all the way, this, and close it with your hand and squeeze on it. And do this. No, like this.
That doesn't really hurt.
Here, and squeeze hard. Okay. Is that painful? Okay. So the problem we see, relax. So the problem is touching the pinky here. Okay. Any pain with this? How much from 0 to 10? Here you go.
It's tender.
Okay, don't hit, okay? Tender, how much pain from 0 to 10? It's right in here, yeah? Is that painful here, doing this?
Not as much as where you first were.
Like the touching here.
Yeah,
You feel pain
that
here?
one
How
hurt.
much pain from 0 to 10?
Very tender.
Okay, so the tools here. So everything we do here should not aggravate your symptoms, okay? Probably will close this door. Oh, that's actually nicer.
Yeah.
A lot of people here. All right, so so the area of the problem is just doing this motion. That's what you have trouble with now. This one. How much from 0 to 10?
You know what? At the moment, I have to say it's
What when I do this?
it's like that that last motion was a little bit tender,
Okay.
but like where you're touching that up here, very
That's
tender.
Okay. Alright.
Tender.
You feel this bump here?
It's tender.
Sorry, is it painful what I'm doing?
It's, yeah.
Okay. So when you jam it this way when you feel on it? How did you feel on it? Like how you jam it?
I don't know, but as soon as it happened,
Mm-hmm.
I knew I was in trouble.
Okay.
I mean, it was
Mm-hmm.
really painful.
Okay. Did you have like lose conscious?
No.
Did you hit your head or
No.
you hit anything
If
else?
the thumb took the whole brunt.
Okay. Well, it's better to hit the thumb than your head. You know? Yeah.
I agree.
Yeah, I don't want you to hit your head. So you have hard time to wash your hair, to shower and stuff
To
like
do
that?
anything, to use
Yeah.
my telephone, my
Mm-hmm.
cell phone, you know, you like to do all the
Uh-huh.
fun stuff on the phone.
Yeah.
And literally just kind of anything. I mean,
Mhm.
opening a doorknob,
Uh-huh.
just anything you would do in
with
your
the
normal
thumb,
life.
you know, people do not realize that you need your thumb for 60 to 70% of the hand function.
That's what I was just
Yeah,
telling
you
my
can do-
acupuncturist. I
yeah.
had no idea how much I used my thumb every
thumb is
day.
important
Yeah.
that people overlook it.
It's like having
Yeah.
a foot problem, but every time you take a step,
Yeah.
you don't realize it till it hurts.
Especially when you are right-handed, you cannot ignore that.
Yep.
Yeah. Let me know if it's too much, okay?
Yeah, it's fortunately most of this. The good thing that the acupuncturist has done is
Mhm.
got the swelling
Yeah.
way down.
But you still like have a lot of stiffness there, and
I
your
still have stiffness.
your
I still
function
have,
has not been improved,
right.
and that's what a lot of studies show. The function, systematic reviews for acupuncture has not shown it's changed a lot in function.
That's why I saw
It
your
showed
video.
temporary pain relief, but the long term was questionable. There's a
I
lot
could
of
tell.
studies, unfortunately.
That's what I
So,
was feeling.
You have a lot of scar tissue, a lot of tightness. I'm not sure the scar tissue can be released with needle. It's
Oh,
scar
yeah,
tissue
needle.
is not gonna be released with needle.
Gotcha.
I'm not sure that will be mechanically cannot be happen.
Yeah.
You know, so might help a little bit with inflammation, but the fascia restriction on the scar tissue, that's not. And when you jam it like this, you scarred all the way here. You can feel it here, and I'm gonna show it to you.
Oh, okay.
Yeah. So when you have a scar tissue, and instead of your muscle contract and relax like this, it's like you have a band, anodynous, and a rubber band. So your muscle does not really totally.
Yeah, it doesn't feel very rubber band. Ouch.
Too much?
Not too much.
Okay, make sure you tell me, okay?
Okay.
It's too much. Okay, I'm gonna. So we have a little bit scratch here. What's going on? What is this? Did you scratch yourself?
Maybe I didn't even know that.
Okay. You don't have cat, do you?
No.
Okay. Oops. So I'm gonna give you a needle. Close your eyes. Not really.
I was like, didn't you just say no needle?
No. If I say like everything should not aggravate your symptoms, that's I should not know the needle. Yeah. Is this too much here? Yes. No. Both.
It's tender.
Uh-huh.
Yeah, it's pretty
Sorry,
tender.
sorry. Okay. So I'm gonna show you the scar tissue now. Sorry.
It's okay.
Okay. Is that tender?
Kind of tickles.
Tickles. Well, it's fun to be here, okay? Tell me. Alright, you see? You don't see that in a regular clinic. People do not laugh, they
Oh,
should
no.
cry.
Uh-oh, yeah.
You feel that scar tissue here?
Very
Yeah.
tender.
You feel
Very,
that?
very
You see
tender.
that? You
If
see
that-
the instrument is just jumping here.
Yeah, that hurts.
Oh,
Yeah.
sorry.
I mean, not in a, but it's
Okay.
very tender.
Very tender?
Mhm.
Okay.
Super mega.
And here? You feel,
Very.
You feel those bump here? Is that too much?
It's really, really
Sorry.
super tender.
So you have inflammation there.
Well, that's what I'm saying. She's gotten rid of like 90% of it. It was really bad.
That's a lot of inflammation.
I know.
This is a lot of inflammation.
This has just been.
That's why you're not
awful.
tolerating the instrument. So I'm gonna be very gentle. I'm
Okay.
gonna do in other areas.
Okay.
You hear that all that scar tissue?
Mm-hmm.
Okay. Too much?
No.
You just move.
I'm just
it.
going to relax for a second.
Yeah, relax. Think about something you like. What do you like?
Everything.
Okay. Think about everything. But you feel that scar tissue.
It's really very tender.
Sorry.
Extremely tender.
Okay. What about here? So you have a lot of
Better.
scar tissue. It's
Easier.
not bad. Okay, relax. So that's your thumb here. Tender here, it's okay.
It's tender, but not.
Okay.
It's more of like a little sharp thingy. But here,
Yeah.
for some reason, I don't know why, that's extra tender up on the arm.
And you will see, look here, you can see the scar tissue with the redness. You see those lines?
I see it. Yeah.
Yeah. Turn it over. Like this. Tender here, it's okay.
It's a little tender.
What about here?
A little ticklish.
Okay.
Sorry.
It's so fun to be here. Alright.
I know. I'm a little bit on the ticklish side.
No, that's fine actually. In your hand, that's very interesting. Yeah. I had patient that ticklish in their knee. That was fun.
Oh, really? That's
But they
interesting.
came for knee treatment.
Of course.
Yeah. And someone was ticklish in the back, and he was like coming for lower back pain.
Right.
Well, it's fun to be here. Okay, so yeah, I had patients says I laughed here more than I laughed anywhere else. I'm like, yeah,
That's
see?
cool.
We don't tickle patients; they just ticklish by themselves. But we have to treat them anyway. Is that too much?
That feels good.
Okay, you feel that? Relax.
Yeah. That one I could almost feel like sparks.
And here, yeah. You know if it's too much.
Yeah, over here on this little fatty part,
What do you mean sparks?
like it's like a live electrical.
Okay.
It's and that finger too.
Yeah, because you have not for 2 years. That's a long time. That's
I kept thinking it
too
would
much.
heal. You
2
know,
years. That's a long time.
you keep thinking
Yeah.
this can't stay forever.
Yeah. Relax.
Well, what actually happened was
Mm-hmm.
it had started to what I thought was like getting better, and then all of a sudden, out of the blue, it started to trigger, and that was really not a fun experience. That was
Well,
very painful.
if a few weeks things did not resolve, I will not wait because
I didn't know
it's
who to go
easy-
to,
It's
though.
easy to address acute stages in chronic condition.
But who am I going to go to? Because the doctor's just going to give me cortisone shot, and
Yeah.
I just don't believe in all that
And
stuff.
now you know what.
Oh yeah,
Okay.
thank goodness I saw your video.
Let's move it now. How's that? Let's touch this. How's that? You're moving faster now.
Oh wow,
Oh,
yeah.
you
look
touch
at
your
that.
pinky now.
That's
Look
wonderful.
at that. That's
Yeah.
beautiful.
It's sore right in that crease.
Okay. But now you're touching.
Yeah,
When we started, it took you like 20 seconds even to get there.
it did.
That's nice, beautiful. That's good. Okay. So let's see. So you feel it right in here?
Uh huh. Right in that crease.
Okay. And you were not able to touch it for the last 2 years? This way?
Well, you know, I didn't really try to because she wasn't really happy.
What, dear?
My thumb.
Your thumb?
My
Okay.
thumb was not happy.
Okay. Now your thumb is happy? Is it too much?
Mm-mm.
Okay. I'm not trying to take it off, you know, I'm gonna keep it in.
Yeah.
It's look like that, but it's not the goal of it, okay?
See, it's real achy, like right where where that finger is,
That's
down,
scar tissue here.
down below
It's
the
a little
thumb.
bit bumpy here.
Yeah, below the thumb.
Okay, so.
Right there.
Okay, alright.
Yeah.
No kicks, okay?
No.
Alright. All right, we'll find a spot. This is not a funny spot, okay?
You're right.
Not ticklish. Okay, so I'm gonna use my hand. Let's see. We'll get some work to do here. Too much?
That feels fine. Feels like your fingernail is
I cut my fingernail. Do you feel my fingernail?
big time.
Really?
Uh-huh.
I cut it. Do you see it? I cut it. There you go. So it's around this area. Okay, try it again. Let's do 10. Look at that. You see how fast? Let's do this. Beautiful. Look at that. Any pain, discomfort?
Just way down here underneath the
What do you feel?
aching.
But no pain or pain.
Just kind of sore.
Sure. Yeah, 1 second. But as long as you don't feel pain, it's fine.
Okay.
Remember, you have not done this motion for a long time.
True.
So you're gonna feel like working your muscle. That's okay.
Okay.
I expect that.
Okay.
As long as you get that range of motion, that's fine.
Cool.
You have a little bit inflammation. We're gonna work on inflammation after the video.
Okay.
But this is that's my goal, to get that range of motion. You're gonna feel a little bit achy because you have not done that range of motion for a while. It's like working out, that exercise that you have not done it for a while. Is that too much?
Not at all.
Sorry.
It's okay. That's a good spot right there.
Okay. Alright.
Yeah, that spot right there.
Sorry. Too much?
Nope, that feels fine.
Okay, try it again now. You're getting that?
Yeah, it's actually starting to feel better.
Yeah?
Yeah. Yeah, definitely feeling better.
Any pain, discomfort? You're moving very fast.
Yeah.
Are you trying to show off now?
Yeah.
Alright, so what do you think about ASTR treatment?
So far I'm loving it.
Yeah,
Loving it, loving
Can
it.
you tell the difference? You had acupuncture before. Can you see the difference in the motion? And the pain?
Absolutely.
Yeah, what's the difference?
Well, the difference is that the acupuncture, I was not supposed to use it, and with this one, it looks like I'm going to be able to start using it again.
Yeah,
Woohoo!
that's the goal, to return to normal function.
Yeah, because
Yeah.
that turns out to be pretty important.
Yeah, well, we need to use it. Yeah. Let's give them thumb up. Alright, awesome.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.